Hi friends, Dr. Tim Garcia coming from my Pain and Wellness Center here in Port Hueneme. Today we're talking about arthritis, and we're going to destroy a myth about arthritis today. And that myth is that with advancing age and years you're going to get arthritis, and arthritis with advancing years, there's no way out of it. And so what we have on the board today is a spine, and I'm going to show you this first joint right here is normal. And arthritis, I will tell you, is characterized by decreased joint space, irregularity of the bony edges, and deformation of the bone. And so if you look at the first one up here, this is normal architecture of the bone, and this is a normal joint space. This is where the disc is. The vertebrae are separated by a disc, and this is where the nerve comes out, where this is all normal as compared to the two below it. You will see that there's irregularity on this bony surface here, and you also see decreased disc space here. And if you could appreciate that, that's about 85% closed compared to this one. Well, this is where the nerve passes out, and so if that is closed, you're not going to have full nervous transmission at that level. These nerves come out and they distribute and go to all different areas depending on their level, and they go to organs and tissues and joints and muscles and everything. Now if you notice the one on the bottom here, this is bone on bone here, and you also see more deformation of this bone, calcification of a ligament, and this is definitely both arthritic conditions as compared to this one up here. Now all these bones and joints are the same age because it's the same person. This is an x-ray of a person who had a long-standing bone out of position, which is called a subluxation. And over time, if it's not corrected, it degenerates. So arthritis with advancing age is not automatic. Otherwise, this one would be arthritic as well. It comes from a long-standing bone out of position that has nowhere to go but to degenerate and arthritis. And so this is an example of a normal bone and arthritic conditions on the same person. Very important that once you have injury or to be checked for spinal alignment and spinal health, because if you're not aligned, you may have degeneration over time and arthritis over time if things are not corrected. So this is one example of arthritis in the spine, and it comes from a long-standing bone out of position. So this is a little information for everybody to have, to give you shed a little more light on what arthritis is, where it comes from, and the point that I had now is to have it checked by a proper professional. And there's other considerations like dietary considerations and water intake as well to help inflammation and help arthritic conditions. So you can see the arthritis in this joint and this joint, and a normal joint here. So that's our lecture for today. I hope you glean a little information and get some value out of this. If you have any questions, please don't hesitate to call our office. We're here to help.